recording the lecture. Okay, so now what are the classification of hernias? What are the classification of hernias? These ones, you have to know them. So irrespective or regardless of the site of that hernia, a hernia can be classified into 5 types. A hernia can be classified into 5 types. Number 1, reducible. So in reducible hernias, the contents can be reduced by the patients themselves or the doctor. So that's all, very simple and straightforward. 2, irreducible hernias. The contents can't be retained, but there are no other complications. So the patient cannot retain that hernia or a sac. They cannot put it back into the abdomen. But there are no other complications. Everything is just okay in that sac. Those are known as what? Irreducible hernias. And then 3, you've got obstructed hernias. So in obstructed hernias, there is an obstruction inside the contents there. But the blood supply is just okay. So in obstructed hernia, the bowel in the hernia is obstructed, but the blood supply is just okay. Now, in strangulated hernias, the blood supply is impaired, and gangrene can occur within 6 hours because the bowel's blood supply has been impaired, it's been compromised, and therefore gangrene is likely to occur within 6 hours in strangulated hernia. And then 5, is incarcerated. Sorry, the spelling is wrong. There's supposed to be IN. So IN. So it's incarcerated hernia. So incarcerated hernias, the contents are literally imprisoned. They are within the sac there. And sometimes they are connected somehow by the adhesions. So they are usually connected by the adhesions within the sac there. But they are alive. So they are alive and functioning normally. So it depends as well. I think Dr. Sachs has corrected me about this. He said sometimes they are not alive. So they may be alive and they may be functioning normally in incarcerated hernia. So reducible, they can be reduced. Irreducible, they cannot be reduced, but the contents are just okay. Obstructed, there is an obstruction in there, but the blood supply is just okay. The blood supply is just okay. Strangulated, the blood supply has been impaired and gangrene is likely to occur within 6 hours. And then for incarcerated hernia, the contents are literally imprisoned in the sac, usually by adhesions, but are alive and functioning normally. That's what we should not forget. So now we go in the depth of the specific types of hernias. Number 1, you have umbilical hernia. Umbilical hernia. So these are congenital umbilical hernia. It's caused by, so remember with Dr. Shinon the last year, she talked about a physiological hernia. So now that physiological hernia happens, it should be during week 8, between week 8 to week 10, where the abdominal viscera in the baby or in the fetus come out or herniate. It's a physiological herniation. So now what happens is that if those viscera or viscous, if the viscous fails to go back in that period of time, in that given time, the hernia is likely to occur, or the baby is going to born with the hernia. And that hernia is known as what? Umbilical hernia. So I think I've explained everything about it. Next we have incision hernias. So an incision hernia is a protrusion of a tissue that forms at the site of a healing surgical scar. The type of hernia accounts for 15% of all abdominal hernias, and an incision hernia occurs at or in close proximity to a surgical incision through which intestine or organ or other tissues protrudes. For example, if somebody has undergone exploratory laparotomy, what happens is that there is that midline incision that they do. So now that has become like a potential weakness for the viscera or viscous to come out. So that is what an incision hernia is. So it's a hernia that happens post-surgically. In short, there is that post-surgical scar that is a potential weakness. I think that's the case that we're having in yellow film. That's the theater case that we're having on Monday. So it's incision hernia. I hope it's making sense. Any questions so far? All right. Okay, you can ask, Zoe. Zoe, you have a question?
Sense, because you asked if it makes sense.
Sorry, I can't get you. All right. Seems to be like Zoe has no question. Let's proceed. So femoral hernias, these are the ones that we are really familiar with. The femoral hernias. So femoral hernia usually occurs when just a part of tissue, I don't want to pronounce that word, but it should be fold. A fold tissue or a part of your bowel pokes through into your groin at the top of your inner thigh. In short, what I want us to remember is that the femoral hernia is the hernia in which the protrusion occurs in the femoral canal. The other thing is that these type of hernias are common in women. And remember, there was a point that we raised when we just started. We said the femoral hernias are common in what? Are rare in men and nulliparous women, but more common in multiparous women. That's what we said. The other thing that we mentioned is that the narrower the neck of the hernia, the higher the chances of it going through strangulation. So, more common in women, cannot be controlled with a truss, and there is a high incidence of strangulation. Why? Because their necks are narrow, very narrow. They should be operated on as quickly as possible because they easily undergo strangulation. And remember, we defined strangulation as when there is an impairment in the blood supply. And we said that if the hernia continues, there is a higher chance or that propensity for the hernia to undergo a gangrenous or gangrene. Yes. So that's what we should know about hernias, the inguinal hernias. I mean the femoral hernia, narrow neck, common in women, femoral canal, and high incidence of strangulation because of the narrow neck that they have. Next thing. Then there is Spigerian hernias. So for Spigerian hernias, I don't want to read what I wrote there, but I'll tell you something very simple and straightforward. Let me just annotate. Okay. So for Spigerian hernias, what happens is that there is that protrusion, or rather there is that bulging, but you cannot necessarily see it outside. This is outside here. That is outside. This is the inside. So that's why they are these what's this? The campus fascia, transversalis fascia, extraperitoneal fascia, all those fascia thingies that we talked about last year and the other year, they are inside there. The hernia is protruding, but you cannot see it outside. It's just ending somewhere, and you cannot necessarily see it outside. That is known as a Spigerian hernia. You cannot see it outside, but it is a hernia that is inside. So it's stuck due to the abdominal layers of the muscles that you have. So that's the like Is it the pathophysiology? No, that's the definition of a Spigerian hernia in layman's terms. I don't know if it's making sense. Okay. Next. So we have a very important hernia. So a sliding hernia. Somebody's calling me.